Okay. Oh. What time is it? Oh, I'm late. Good afternoon, everyone. How are you?
Good afternoon, Marianne.
I'm sorry about that. I was all set and then just couldn't access. So here I am. But since it's after 2:00, I'll go ahead and get started. Do we have a quorum, Jason? We do. Thank you. All righty. First of all, I would like to welcome Jeanette, our newest advisor, and of course, Wendy, who is now formally a board member. So I just wanted to highlight that this morning.
Thank you so much.
You're welcome. Yes.
Welcome, Jeanette.
Thank
So
you.
I'm going to go ahead and take a roll call. Dick Cooner,
Yes.
Dr. Copeland,
Present.
Dr. Gorski,
Here.
Dr. Giardini, Tim Neighbors,
Here.
Linda Sandquist,
Here.
Wendy Larson Bennett.
Present.
Okay. Also, public comment at this time. Jason, we did not get any outside requests for public comment, so.
No requests.
Okay, very good. And moving to our next item on the agenda, which are presentations, and I do believe we have a presentation, or not.
No
no, we're not.
presentations today.
Okay, but I thought that this is where we're going to hear from stepping stones in the sheriff's department, but that's further down. Okay. I'm going to move on down to the monthly activity report, and I'm going to ask Jason to clarify that for us.
Yes, well, the big thing I'd like to report to you is that our grant application has closed for the next program year, which would cover June 1st of 2022 to May 30th of 2023. That'll be our second year of funding. We received 34 applications in total. Many of them were collaborative applications that included multiple agencies working together. And we had a total funding request of $18.3 million. Of course, we have up to $15 million to award.
Right.
And some of the feedback from the agencies this year was that it was just a much more collaborative process in terms of convening everyone right at the onset of this and providing a platform and forum for organizations to connect with one another. That created a lot of conversations among organizations. It was noted from Joan Lodge at Rosecrans that a number of smaller nonprofits connected with her, and she was able to provide a little bit of support and mentorship to some agencies that had not applied in the past. So it seems like our intention on promoting collaboration this year really manifests through the process.
Well, congratulations on all the work in your staff for their diligence. Now, we had a total of 39, is that correct?
37.
30.
10 of those were renewal applications and 24 of those are new applications. However, 5 of the programs that were funded last year filed new applications for their program, either because they wanted to expand it beyond the 5% increase or they wanted to add new priority areas to their applications. So all of the programs who were funded last year did ask for funding this year, either as a renewal or as a new application to expand their program further.
Well, remarkable. Anyone else have anything to add at this point about?
It was 34, not 37, Jason.
I'm sorry, is that not what I said?
It was 34, you said 37.
Yeah, 34 applications.
Amazing. Okay, well, thank you all very much for that. Moving on into our action items, I'm going to need a motion to approve the January 2022 meeting minutes.
So move.
Okay, Tim, thank you.
Second.
Okay, Dick, thank you. Any discussion? Hearing none, I will go ahead and take roll call. Dick Cooner,
Aye.
Dr. Copeland,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Yes.
Linda Sanquist,
Yes.
Wendy Larson Bennett,
Yes.
Mariana Body, yes. Okay, and now we're going to move into the August 2021 meeting minutes updated. And so I'm going to need another motion for approval for those meeting minutes. Any motion? Thank you, Dick. I need a second.
I'll second.
Okay, thank you, Wendy. Any discussion?
What
was
the?
If I might just note, yeah, so the update
Good.
was the addition of the voting for the anti-retaliation policy that was adopted by the board that month when we were going back and reviewing records in order to discuss the bylaws update with the attorney. We noticed that that was not appropriately reflected in the August meeting minutes that was voted on. So since we do have a recording of that meeting on YouTube, we were able to go back and watch the recording and appropriately update those to reflect the vote that took place on that.
Thank you for that, Jason.
Thank you.
Any other questions or discussions regarding those minutes of August 2021? Hearing none, roll call. Dick Cooner. Dick,
Yes.
Dr. Gorski,
Aye.
Dr. Copeland,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sanquist,
Aye.
Wendy Larson Bennett,
Aye.
Mariana Body, aye. Okay, at this time, the FY 21-22 funded program budget amendments, and I believe we're going to have both the Sheriff's Department, and this was tabled from our January board meeting, the request for the individual agencies to present the amendment change request, and also stepping stone. So first on the agenda is Sergeant Ponte, as I understand. So please take it away.
Yes, I was told that there was a couple of questions that they wanted to know on the proposal amendments changed. Some of the things that we had found out in initially starting this program is the amount of time it takes to make sure all the collaborating parties are all on the same page and we're not duplicating things. So one of the things that we had wanted to make an amendment to add is an independent person that the county would hire to oversee the whole entire program and the grant process. So this person would be responsible for not only making sure that the list of, I think it was like 30 items that I gave the mental health people that were tracking, they'll be responsible to make sure all that stuff is being tracked. They'll be making sure that the communications between the jail program, the CCRT, the public defender's office, pretrial services, the courts, the discharge planning portion with the community, making sure that the services are getting connected with the inmates prior to them leave. This is what this person would be responsible for doing. So far, since we've had the new program up and running and the people in place just in the month of January, I believe we've already assessed and reviewed between 400 and 600 people. And by the end of this month is when the time frame was for them to start the individual counseling sessions as long as the group counseling sessions. But as I had mentioned to Jason in several conversations and meetings that I've invited him and other board members too, it's just becoming apparent that the amount of time needed to make sure that we meet the gold standard that we set for ourselves, because the sheriff and I are on board with this program 100%. A lot of the things that we're doing inside the jail has not been done in any of the other facilities across the state, and some of them even in the country. I was just in North Carolina last week on a training, And the jails there, they were astonished of what we're doing in our facility as far as the mental health programs and the Narcan programs and the Datora programs, and how our community is so involved in making sure that the mental health people and the substance abuse people aren't doing recidivisms and all that. One of the things I presented at that is we're in the process of following the Ohio-based risk assessments that we're going to start implementing here within the next couple of weeks. And basically what that assessment's going to do is screen everybody that's coming into the facility, and based off their risk of recidivism, we're going to recommend to the courts certain programs, discharge that falls into discharge planning. It also folds into the specialty courts. So with all the cool stuff that we have in place that we want to be the standard, the gold standard that everyone follows after, is also taking an additional person to monitor and make sure all this stuff is being followed. And unfortunately, I just don't have the time to put into the program to make sure that's as successful as we want it to. So that was the amendment that I had spoken to Jason to present to the board, to just shift some funds around so that the county can hire an independent person to monitor and track and make sure everyone's interests and no one's duplicating the services. We're not duplicating any assessments, and to truly make sure that it's a streamless, cohesive team throughout the whole entire process with the justice system and the community as well.
Okay, thank you for that. I do have a follow-up question. In terms of, you had mentioned at the very end that you're going to be shifting the funding. Exactly, can you explain where that funding is being shifted from?
Originally, we had the line items that itemized the professional contracts, which I believe was on line item 17. We had the line items for medications, which were staying there. So basically, those items would transfer over to the line item that's on there for the contractual language. Because the way that we're being billed from Freedom, that includes everything. So it made more sense, rather than having individual line items and some things crossing over for that, just to put the whole entire mental health thing under one spot. And then based on the amount that we received for the individual contracts for their services and the late start that they had, there was area in there to move to put in a position that would be up to $55,000 for this person to be hired, with the addition of I think it was like 33 or 35,000 for benefits. So it just came out, I believe, under 85,000 or 88,000 that this position would be funded. So the money's there. We were able to save some costs on some of the equipment purchases we have. We were able to save costs on the Mitel phones, so we got a discounted rate on the phones and the laptops as well. So that's where the money would be shifted from one line item to create that new position.
And Sergeant, is that money or is that position going to be coordinating all the mental health and substance abuse services across the jail system, or simply the program that the mental health board is funding?
No, there's going to be across the whole entire system. The main goal is to have this person not only be in charge of the grant program that we're funding, but also make sure that they're meeting with CCRT, they're meeting with all these other individual players to make sure that because our goal is to have the inmate assess when they come in, why they're there, and when they leave. And one of the disconnects that I've seen in the 21 years I've been there is when they leave. So it's very important that the person that we have for this position is monitoring that through the whole entire criminal justice programs, all of it. So that not only they're going to follow it inside the jail, they're going to be getting with CCRT, and they're going to be getting with the pretrial, probation, state's attorney's office. They're going to be going to the courtrooms and meeting with the judges, the specialty programs, just to make sure that we're all on the same page and that no one gets dropped or lost. And then, it'll be like CCRT's responsibility once they get into the programs in the community to monitor them, their progress and progressives that are inside there. So it's setting this cohesive stream so that we're all on the same page.
So you're coordinating, that's part of like the warm handoff process to make sure
Yes.
the client gets connected in the community.
Correct. And not only that, one of the things that we're also doing on the initial assessments is we're doing a release of authorization when we first meet with them. And what that allows us to do, especially with the electronic medical record system that's going to be up and running by the end of this month, will allow us to give real-time information as far as their status and all that to the judges, the pretrial services first thing in the morning. So therefore, when the public defenders or pretrial services or probation is going in front of these judges at the specialty courts, they have the current up-to-date live information so they can make sure they're being placed in the correct specialty court and programs and so on.
Got it. Thank you.
You're welcome.
I would like to make a motion that we accept the recommendation from the sheriff's office and make the budgetary change.
I second.
So we have a first and a second, and is there any more discussion or questions? Bill?
You're
Dr.
muted.
Gorski?
You have to unmute. Sorry about that. Sergeant, would this person then report to you?
Yes, this person will report directly to me. And I stay in constant communication with Jason. I have Jason attending when he can a lot of these meetings that we're having with the judges, with Freedom Mental Health. I think it's very important that all parties be involved in this and that they understand what we're doing. Some things will take a little bit longer to get, or time to get done than we'd like, but to make sure it's done and it's done right.
Great, thank you.
If I can speak to that point, I will just say that Sergeant Pont has really actually been the model of communication in terms of keeping us in the loop with every update along the way. So I just, aside from this point itself with the budget amendment, I just applaud that program for how much they have included us in the conversation and the coordination of services.
And I do have to attest for the fact that Jason brings this up all the time. He would like to have a sergeant such as Sergeant Ponce in every agency that we fund, because you have been a great communicator. So thank you very much from the entire board. It's
Thanks.
so critical. So, okay, Tim.
Good luck with your goal.
Yes.
Thank you.
I
Tim
want to
Meeker?
know if this is a new hire or somebody that already works with the sheriff's department.
It's not, it's going to be a new hire. We were waiting on the board's approval. And then once we got that, then we were going to have the administration over at the admin building post that position with the requirements for that, so that anybody in the community can go for that position if they qualify for it. We just wanted somebody that wasn't part of like Freedom. We didn't want somebody that was part of the sheriff's department. It was important to me to have an independent person that has the county's best interest at heart, that doesn't have a hidden agenda, so to speak. So it was very important to me to have an independent person do that role.
As long as they have the mental health expertise needed for
Yep.
this, I agree with that too.
Yes.
Okay, any other discussions or questions for Sergeant? Hearing none, I'll go ahead and take the roll call for the approval. Dick Kunert,
Yes.
Dr. Copeland,
Yes.
Dr. Gorski,
Yes,
Dr. Giardini,
Yes.
Tim Neighbors,
Yes.
Linda Sandquist,
Yes.
Wendy Larson Bennett,
Yes.
Mary Ann Abadi, yes. So you do have our concurrence and approval for that amendment. Thank you very much for your concise presentation. We do appreciate you answering our questions.
thank you, Sergeant.
Yep, thank you, and I appreciate it and look forward to doing the best we can to make sure our community is taken care of.
Well, we appreciate that.
Yes, we do.
Thank you.
Thank you.
Moving on now to stepping stones. I believe Sue Schroeder is going to be presenting their request for an
Great,
amendment.
thank you.
Sure.
Thank you for hearing us. One of the lessons we have learned is, having been known as a premier residential provider for almost 53 years now, that getting our name out there as an outpatient provider, somebody who sees people in a counseling center, has not been as easy as we thought it was going to be. Finding staff, as everybody is having, has been very difficult, as has been building up our caseload. When we put in the application to you all, we thought we had found a building that we were going to be able to lease. It was one that we felt like we could just walk in the door and be able to move in furniture, and we would be set and ready to go and up and running, hiring almost immediately. And when we did our last walkthrough with the realtor, we learned that there was a lot of water issues in the building. As we were walking across the floor, the water was sloshing onto the tops of our shoes. And a couple of us went home and had pretty severe headaches that night. I was like, this is not our building. So it was back to square one with where are we going to provide services. We were able to find and purchase a building over on Murray Drive. There's no other counseling centers in that area. It's kind of in the state and alpine area. For those that have animals, it's almost across the street from where the emergency animal clinic was until about 2 weeks ago when they moved. So I think that we picked a neighborhood that's kind of a counseling desert. We entered into a contract to remodel the building. We did our final punch list walkthrough last Thursday. We have, what do they call it from the city? Temporary occupancy, a limited occupancy, where the furniture is going to start to move in tomorrow. We are waiting on we have a temporary electrical panel in right now, so we need to have the final electrical panel. I've been assured it's been made in the United States, so it is not on a slow boat, but it is being delivered to us. We hired our second therapist yesterday. So we feel like we're up and running. We've got flyers. Our current therapist, when he's not seeing people, has been out in the community dropping off flyers at the Boys and Girls Clubs and the churches and the police departments and the hospitals, places that will allow us to drop off paper. There are still places because of COVID that doesn't want anything that somebody's going to touch. But we've been trying to get information to them electronically. So what we are asking is to be able to move some of our expenses around. Obviously, we had hoped to have 8 therapists and 2 case managers by this point. We're not going to be able to hit that target by the end of the budget year. Because of the numbers of individuals we're serving, we have money in our budget to provide medications for people that don't have a way to pay for them and to pay for services for people that don't have the ability to pay for them. We don't need as much money in those line items. And our contractual, we do have a contracted telepsychiatrist to be able to provide telepsychiatry. But because of our number of clients, we don't need the number of hours just yet. So we would like to move money from those line items and move them into the direct occupancy and use the county tax dollars to help us pay for the building, pay for the remodeling. And we think it's a benefit that we had to buy as opposed to lease. Because now we don't have those ongoing payments and expenses. It is a building that we own that we can really make into the facility that we need it to have. So that's our request, and thank you for hearing, and I'd be happy to take any questions.
Does anyone have questions?
Dick does, but he's on mute.
Yeah, Sue, public transportation, you're close to that?
There's a bus stop right at the end of the block.
Okay, all right. And so what do you think from a marketing point of view? How are you going to, or what are you mentioned that your therapist is dropping off flyers, but do you have any other ideas about how you're going to approach coming on to the east side?
The new therapist that we just hired used to work for the YWCA and has quite a few contacts there. Her expertise is in children. So she's actually got 12 people on her waiting list before she ever started yesterday. We've got 2 contacts at the schools that have said, please let us know as soon as you have somebody on board that treats children. We're going to link with she's also got a pretty heavy trauma background. So we're a lot of just foot traffic until her caseload gets up and running. we're going to have her out dropping off flyers and reconnecting. She had moved to the Dixon area for a while and is now back in Rockford. So making connections with some of those people that she had connected with previously. And if y'all have any other ideas, we're happy to take them and run with them.
Will you be taking Medicaid at that site as well?
It's primarily Medicaid. That's our target audience is Medicaid.
Okay.
Everybody we have served thus far is either Medicaid or one was Medicaid pending. So
Okay.
Medicaid MCO, I lump all of those together. But yeah, no, that's our target.
So is there collaboration like with Crusader? You mentioned the YWCA. I'm sure they also have waiting lists and things. Can we let other agencies know that you've got services available and maybe collaborate
Absolutely.
a little bit? Yeah. Okay.
Absolutely. I know that Crusader has hired their additional of their own behavioral health therapists. So I do not know what kind of waiting list they have. Monique, our new therapist, is going to reach out to the YW. We have reached out to like the Tommy Corral Foundation, Marshmallows Hope, some of the other kind of not-for-profits in town that do some advocacy and that type of stuff, but don't really do the therapeutic counseling services.
And how about the Peace Center? I'm just thinking children.
Yeah, we can certainly reach out to them.
Yeah, I don't know what their arrangement is, but
No, that's a great idea.
Yeah.
I'll reach out to Jennifer.
Yeah.
Dr. Gorski?
Yes, Sue, thank you for the work you do, first of all, and for meeting the challenge of the facility issues. I'm just having a hard time, maybe I'm the only one, figuring out, I'm looking at the budget numbers, but what is the exact shift in dollars you're asking for, from how much from what line item to what line item?
I don't have my old one with. The budget that we presented, it's a deficit budget for this first year.
Right.
So we're asking for the 470 that we originally asked for. And then reducing the amount of money to what we believe is a real and accurate number for personnel and medications and services and the teledoc, and moving the rest of that into the direct operation occupancy line item.
Is it 63,000 and change? Is that what you're moving? Or because I see some numbers highlighted in the line items.
Yeah, I saw that too, Wendy, and I wasn't sure if that was it.
I'm not sure how they got highlighted. I can turn to my other computer. I can pull up my original one and I might be able to ask you. I only have my revised one in front of me.
Well,
Okay.
Jason may.
Yeah, I was going to say maybe Jason could, since he has both.
Yeah, I can pull it up. But I think to Sue's point, the main kind of component of here was basically authorizing money that was otherwise budgeted for personnel to be allowed for occupancy in the form of renovation and purchase of building. I believe in the original budget, there was $100,000 allocated towards that. And so with the new budget, the budgets are a little bit complex when there's revenue generation involved with the program, because it's not a one-for-one. What they're asking for the mental health board covers all components of the budget. If there's Medicaid revenue generated, that becomes part of the budget. And we're essentially authorizing mental health board funding from the half-cent sales tax to cover anything that's not covered by the revenue generation of the program. And Sue, as I'm pulling this up, if you could please clarify too on the deficit budget, is my understanding from your email that you'll be self-funding
Correct.
the 600,000 that's showing up in the budget as deficit, correct?
That is correct, yes.
Okay, let me just, if you have any other questions, go ahead and ask and I'll pull up the original budget.
No, that's helpful, Jason, the further clarification. My thought behind my question is, if you shift something to capital expansion now at the expense of something else, do you shortchange yourself in the future when then you need to go back to the personnel issues? but understanding, what happened with your facility, kudos to you for making that pivot. And it sounds like it's absolutely something you have to do anyway.
Yeah, as Jason said, the budget that we presented has a deficit budget of 635,000, and we are going to undertake that in our own budget for this year. We are one of the agencies that submitted a continuing budget for next year, and we submitted it for about $145,000 less than we did this year. The current year, when we had put in our salaries, we had asked essentially for the board to pay for the full 12 months of salaries. In the new budget, we're asking for 6 months of salaries, knowing that by then, hopefully we can get them built up to a full caseload. They're paying for themselves.
Right.
We're not looking to make money off the county dollars. We're just trying to get a program up and running that we believe the community really needs.
Yeah, thank you. That makes sense. Thank you.
So you're going to continue your hiring efforts.
Oh,
You're just-
absolutely.
So what you'd be asking, you just want the flexibility to
Yes.
take what doesn't get spent and put it into the building.
Correct.
Right.
Whatever
It's
that
not
number might
additional funding they're requesting.
Right, it's just moving it up.
Yep,
Got it.
just
Understood.
moving it around, being
Right.
able to help pay for the building because we don't have staff to spend those dollars on.
right.
And I don't want to give the money back to the county.
I
Heavens forbid.
When you have a deficit budget, so it's
right.
obvious. Okay.
Yeah. Well, and and it is building up the clientele, adding the staff. It's kind of a delicate balance. I might be able to go out and hire another therapist next week, but if I've got my brand new one with a caseload of 12 and my existing one with a caseload of 30, does it make sense to add another therapist next week? It becomes kind of a ballet, a tightrope dance to make that happen, and without having somebody sitting around paying them to not do much.
I get it. Okay,
Any
any
other
other
questions?
questions? Yeah. So I will need a motion to move this forward.
I move.
Thank
Second,
you very much. And we have Linda and Dr. Gorski. So unless there is more discussion, I will begin roll call. Dick Cooner. Dick,
Yes.
Dr. Gorski,
yes.
Dr. Copeland,
Yes.
Dr. Giardini. Dr. Giardini?
Muted.
Oh,
Sorry, can you hear me?
now,
Can you, all right, my screen keeps freezing up. Must be because I'm cold. Yes, I'm good.
okay, that's what we're waiting for. The yes, okay. Tim Neighbors,
Yes.
Linda Sandquist,
Yes.
Wendy Larson Bennett,
Yes.
Mariana Body, yes. So it is approved. And
Thank you very much.
Sue, for your clarification. All right, moving down to our next action item is the 21-22 funded program special conditions met. And Jason, do you want to just focus on that?
So just a couple of them this month. The Family Counseling Services fulfilled their special condition, in my opinion, of developing some type of client satisfaction survey. And they have that's attached in the board meeting packet. You'll see the satisfaction survey that they came up with that they'll be implementing with their clients. And then secondly was a special condition for Remedies Renewing Lives on their substance abuse programming to develop fidelity measures for outcomes. And you'll see a number of them that they developed, and they have outlined them pretty clearly. So it's my opinion that they've met their special conditions, and I think there is not much controversy here. It's pretty cut and dry in my opinion on these.
And again, great job on tracking all of this. This is not easy. So thank you, Jason, and thank your staff as well. Moving now, oh, do we need to accept this with an action item?
These are voting items for the special
Yeah.
conditions, yes.
Yes, okay, so we
So
have
moved.
two
So moved.
special condition programs that have been met, and we need a motion for approval,
So moved.
okay?
Second.
And Tim with the second. Any discussion? Hearing none, roll call, Dick Kunert,
Yes.
Dr. Copeland,
Yes.
Dr. Gorski,
Yes.
Dr. Giardini.
Yes, sorry.
It's all right. Tim Neighbors,
Yes.
Linda Sanquist,
Yes.
Wendy Larson Bennett,
Yes.
Mariana Body, yes. Okay, moving now to our fifth action item, the new board member recommendation. And we tabled this from our January board meeting. Since that board meeting, Jason had sent again the applicants that we had and then asked for any feedback. But in the meantime, I know that the chairman came up with his own plan as to how he was going to get the applications out to the public. But then I know that Tim had conversation with the chairman, and Tim, if I don't have this correct, you correct me. But you had informed Jason that the chairman would still be open to any recommendation the board had. It doesn't mean that that's going to be the way he goes, but obviously he said that we were free to send one. Well, Jason also, the only person on our board that was recommended through our last conversation was Jeanette Towns. She went ahead and went through the chairman's office. Jeanette, you correct me if I'm wrong, and you made your application through his office now that he's doing his own thing. Is that correct?
That's correct.
Very good. Okay, so Jeanette has formally applied. However, she won't be the only one because this has gone out to the public now. So from our board position, we have no further recommendations at this point in time for the vacancy that exists currently. So we will wait and see exactly what the chairman decides. And that could be today, or it could be, whenever. We wait a long time for Wendy to be assigned this board position and Jeanette to be assigned as our new advisor. So we will wait and see what happens and take it from there. So any other, so this is an action item. So I don't know exactly what the motion should be, Jason, to be honest.
Well, can I ask a question?
Oh, of course you can.
Part of the process that we went through and part of the process we went to as a board was to say, well, who are the people who have been involved in the process of the mental health board, whether it was acting in an advisory capacity or were involved in the mental health community in other capacities. And at this point, I know that Jay Ware has indicated he wasn't interested in becoming a regular board member. But we then also, I understand Jeanette is applying, but I'm going to hope that she gets appointed to the board, but then we don't have any advisors to build on in the future. And I'm wondering if that's something we should be talking about as a board for making recommendations to the county board based on our sort of unique position in the process.
Well, that's a point that Jason, is this, you have talked with the lawyer about our bylaws and so forth. So there may be, can you explain a little more about the advisor position going forward?
Sure. So what the attorney is trying to do for us is update the bylaw, either update the bylaws or remove the bylaws and in its place have a resolution that defines operational procedures beyond that which is already dictated statutorily in the Illinois Community Mental Health Act. With the passage of the sales tax language, it now it makes this board kind of an official statutorily, with statutory authority, community mental health board, or at least through the sales tax law, it dictates that it should operate like a community mental health board. So in that process, the role of advisor has come up as a question of something that really doesn't have statutory authority or is not really kind of addressed in the Illinois Community Mental Health Act. So that's kind of being shaken out, I think, in terms of what that should be. So I think maybe when we have better clarification on what that recommendation is going to be and put that before the board next month, then maybe we could have more conversation on what advisor actually means.
Yeah.
Thank you.
So that is helpful clarification, because right now things are changing because of, we are statutorily now official as of January 1st. So that's a big deal for us, because we were waiting, until the new year for it to go into effect, and it did. So, okay, any other questions about that right now? I mean, but getting back to that, what should the motion be? Okay, Dick, go ahead.
Of course, you got a question.
Oh, Dr. Gorski.
Yeah, well, thanks, Marion. Maybe just to clarify my confusion a little bit. So, Jeanette is now our advisor, but has applied for the position and
Right.
it's come through our process as a recommendation. I'm trying to understand now, but the chairman himself is seeking applications or persons of interest to the board on his own, basically. So they will come to him, not through us.
Yes, exactly.
Well, if he has additional or alternative recommendations, will that come back to us for vetting or for?
I
didn't hear that end of it. I heard that he will just make the decision.
He asked me to come with him, I believe this Friday, to review all the applications.
Oh, he did. Good.
Yeah. So he still has the old applications. The recommendation we have from this term, and he opened it up for new applications. So we're looking over all those applications.
That's a good question.
Yeah, and just to draw on everyone's recollection here, Jeanette was recommended as being made a board member in the last recommendation. So if he still has that, that recommendation is still there. And so, Marianne, to answer your question, since this was a tabled item and it is an action item, maybe just to formalize that, the motion would be that you're not making an additional recommendation to the one that was already made, which included Jeanette Towns.
Okay, there's a motion. So I need someone to make that motion, one of the board members.
I got one more question.
Okay.
Well, for Jason and legal. So as far as the advisory position, is it looking like that we're in the future, we won't have an advisory position any longer, or are we trying to keep the advisory positions that we have? Because that's one of the other questions that the chairman wanted clarification on in his selection process.
I think maybe the recommendation from legal would be to phase that out, not necessarily that any current advisor would have to be removed, but just that there not be future appointments of advisors. just because there's no real basis for that. But we can, now is a great time to discuss if there's any alternative opinion to that, so I can reflect back the viewpoint of the board to legal counsel.
You know, the main thing, Jason, is I think it's useful for people who are interested in becoming involved in the board to have some grounding in what the board's work is. So, obviously the public is invited to meetings, but somebody who is actually interested in being on the board probably should have some experience of sitting on the board, in on board meetings and understanding what the work is that gets done on a day in, day out basis. As the chairman is considering who he chooses to nominate.
If I may,
Yes.
Wendy, I think I like what you said about grounding with an advisor. I think advisors are good. I think of Jay and Wendy both. You guys are, wonderful advisors. I think you were very poignant in making sure, Wendy, with your law background, that's huge. And I think if we can find an advisor with that sort of background or similar background, that, in my opinion, I think is a good idea. Just stating an opinion.
Well, I don't think, anybody's disagreeing with that. The only thing is it's now out of our control pretty much.
Right.
So it's really up to the chairperson or chairman of the county board. Yeah, Tim.
Isn't from what I'm understanding is not out of our control per se, as if we want to keep it with, that's something that we will have to write in. So
Right in what?
Write into our bylaws or statute or statute to have advisory members. But right now there's in the statute, there are no advisory members. So if we want to keep them, that's something that we will have to write in. Am I correct, Jason?
Yeah, basically, it's not in the Mental Health Act. So if you want to have position advisors, it might be worth adding that into the bylaws and defining what that means. As it stands, there's no term limits for advisors. They're appointed. The two that have been appointed by the county board chairman. There's no definition really of what that role is, whereas all of the board members have specific, within the Mental Health Act, specific duties that are described. So I guess that's the point of.
May I?
Yes.
So I think we're all in agreement about the benefit of advisors, but given that it's not, given what Jason just said, and we seem to have, it's not necessarily a restriction, but the flexibility now to really decide how we want it to work. I would suggest that, and I've thought about this before, that maybe this is an opportunity for us to think through the ideal situation as relates to how we want to groom new board members, and just having an advisor in the meetings is one approach, but maybe there's some other approaches that we might want to look at, since whatever we do, we're going to have to either do it by resolution or adjust the bylaws or whatever. And maybe the bylaws as they stand right now might give us some flexibility that we're not taking advantage of as it relates to an advisory team, an advisory board, whatever. I'm just saying that maybe we need to broaden our horizon and think through not what is allowable, but what is ideal as it relates to grooming and having sort of a, for lack of a better word, a farm league as it relates to board members.
Exactly.
A bench. Well, the one thing that I think would be very helpful is in terms of what our legal counsel is advising us, that we get definite clarification, because the way that I understood this, and Jason, you correct me here, is that he does not believe we should have bylaws at all, because And you can fill in the blank there, what he said specifically about that. Why does he not think we should?
Well, I think that was the initial thought, was that the bylaws might be needed, but I think after I showed them the bylaws and all the
Yes.
things that were in it, that there may have been a thought that we should keep bylaws and have some of those things dictated. So honestly speaking, we just ran out of time for me to have that conversation
Okay.
before this board meeting. So I am going to follow up with legal counsel. I'm glad we had this conversation first, because now I can reflect back to legal counsel the board's intent on what an advisor's role is and how that can support the board function, and find out maybe now just legally and statutorily how that gets incorporated into whatever it is that legal counsel provides us to move forward with.
Okay, that clarification will really be helpful, but for this particular motion, we are just, we did get someone to move what Jason had summarized, and that is that at this time, this was actually a tabled issue from the January meeting, and what we're taking the vote on today is that we do not have another board recommendation for the current vacancy. Is that
Mary Ann, I'm sorry, I have one more question before
okay? And that's good.
the motion. So maybe a little clarity that I need as well. So to Ed and Wendy's point, it seems to me the advisor position does have value as that training ground or that onboarding type of trajectory for folks. But I thought I heard a couple different things. So there's a pathway to somehow write in the formality of the advisor position. If not through a bylaw, then I thought I heard the word a resolution somewhere. But then I thought I heard Jason also say that the lawyers were saying they thought that the position itself should be phased out.
That's what I heard. Too. Yeah.
Not necessarily as it applies to current, whether it's Jeanette or Jay.
Right.
So I'm kind of hearing what I thought a grandfathering of current advisors, but it should be phased out. But then I thought I heard there's a way to write it in so it's more codified, if you will. So I'm a little confused.
Well, Bill, I guess my thought is this, that personally, I want to see a continuing expansion of the diversity of the board. There are many ways for a board to be diverse, and by opening ourselves to having, as Ed called it, sort of the farm team of people who have an absolute interest in mental health and substance abuse treatment at our community level, we're sort of building a resource pool for the board and a group of individuals who understand that this is a working board. You know, it's easy for boards to become just rubber stamps to an administrator. And I think we are all committed to that not happening to this mental health board. But that means that, you know, at some point, Dick and Mary Ann and Ed and, you know, so on are gonna move on. And who do we have who's going to fill those shoes? And this is the time to be developing those resources, you know, for us and for the county. So that whether we call it advisors or, you know, the fishing pond or whatever you want to call it, you know, I think our board has some community obligation to create resources to grow the board, to continue to make it relevant in the
I couldn't
community.
agree more, Wendy, with you. My point is the advisory function, the formality of that? If it is there a way to codify it so that it is formalized and approved or even grows?
Right.
And then not having term limits could be an issue for that as it relates to, you know, writing it in a codified fashion.
Right.
I agree completely. My question is the advisory role that farm team, or is it some other, I think where Ed was going is there's some other pathway to achieve the same thing.
Mechanism for this,
Yeah.
yeah.
Well,
Well-
Jason has his questions to ask the lawyer now.
Yeah, I mean, that's gotta all come through the legal. And so,
It seems to me, folks, that this is a discussion that we needed to have, because the one change that we know about is the lawyers saying to us, you now are under the mental health code. The mental health code does not provide for advisors. Okay, that's the principle. So now we have the option to say, do we want to create some mechanism that gives us the decision ability to have either be mentors from, of people who, just as an example, I would like to know more about some of the new addiction treatments that are going on. I feel comfortable under the mental health rubric. With the addiction, field, that's something that I would value is someone, saying to us that they would like to, in a sense, be an advisor to us as we work toward, our array of services that we want to put in. And so that's one, so that the input of expertise of a particular area. The other one is the reverse of that, and where we have somebody, recovered people or people who potentially could be really good board members with their background and expertise, but they need mentoring about how the formalities of board operate. And they're not yet comfortable with the formalized structures that the board. So I would just hope that we can say, all right, we don't have advisors in the way that this board was initially put together with advisors who came through the chairman, but rather now we want a mechanism that just simply allows our board to on a task basis or on a mission basis to bring people to us to advise us. And it can be temporary in terms of fulfilling a particular mission. Or it can, it can be a longer thing, but that's all but I would like to see us at least have that option available to us.
well, I agree with what you're saying, Dick, and I think the important part for us as a board, if we took it out of the assignment of having a county board vote for every advisor,
Correct.
that would, I think it would really be much more useful for our purposes in planning and, what the gaps are, that we're looking at for the kind of expertise you're talking about. So, yes, Tim.
Jeanette had a question before I did.
Oh, Jeanette, I see,
I'll go
she's
after
not
her.
on my screen here at all. And do I even see her hand up? But,
I'm here. Yes.
okay, Jeanette.
With the open board seat being as it is, isn't it possible that somebody that's not an advisor or just from the community can come in without being an advisor directly into a board seat?
Oh, it's all up to the
It's
chairman.
all up to the chairman.
That's how we all came on this board. He assigned us. And it's and that's why Wendy came onto the board the way she did. He assigned her. So that's part of the statute. Yeah.
So my question would be, well, to piggyback on what Dick was saying. So when we get to, if we choose to try to find a way to have advisories, that's out of the hands of the chairman, and that's totally up to the board. The other thing I want to be cautious of, I want the legal to give us the pros and cons of either way and give us their reason why we shouldn't have advisories, because they wouldn't say it just for no reason. So I would like to have that too.
I will express the conversation the board's had. Of course, it's also on YouTube, so I will encourage that maybe our legal counsel watch the conversation so they can hear the nuance and the intent. And I
The
will,
concerns.
and I will invite them to attend our next meeting so we can have a thorough answer to all of our questions.
All great. Yeah.
I would
Okay.
my recommendation is that we put this off then to, we continue this discussion at our next meeting.
But that has nothing to do with the, I mean, this is a separate issue. Because we're talking about board member recommendation, not advisor, anything like that. So we've already tabled this from the January. I think that, unless I'm misinterpreting, I would say we should just go ahead and say at this point in time that we need a motion to just clarify now that we have no additional board recommendations.
I'll make that motion, Mary Ann.
Okay.
I'll second.
And Wendy, was that Wendy? Because I
Yes.
don't see everybody. Okay, so we have a first and second. Any further discussion? Okay, hearing none, I'll take the roll call. Dick Kunert,
Yes.
Dr. Copeland,
Yes.
Dr. Gorski,
Yes.
Dr. Giardini,
Yes.
Tim Neighbors,
Yes.
Linda Sandquist. I think Linda had to leave
Mhm.
early. Wendy Larson Bennett,
Yes.
Mary Ann Abadi, yes. Okay, thank you all. And that was an important discussion to be had, and we'll continue it. So moving on now to the 22-23 grant review decision timeline. And Jason, if you just want to summarize that for us.
Sure, yes. Now that we have an official number of applications and we know how many reviews there will be, we've put together a timeline that we think will be appropriate and realistic for doing reviews. I appreciate that every board member has volunteered to do reviews this year, that we have 8 current voting board members, so that will allow for each board member to only have to do 20 reviews. I know when I say only 20, that's probably a little contradictory, but last year there were 18, so it's really not that many because of the increased participation. And the other thing that we are recommending for our timeline is that we sequence the applications so that the renewals will be done first, and that board members will have our packet of compliance information for each of those programs, so you understand how well, from our experience of the programs, they complied to the requirements this year, and you can use that with your review of those. And while the board members are doing those reviews, we would be putting together summary packets of all of the new applications to assist you with your reviews of those, so that hopefully you don't feel that you're having to vet information and go read peer-reviewed journal articles to determine for yourself if something is evidence-based or best practice or promising practice, that we will have that information provided for you. And so we're recommending that the first review period be 3 weeks for renewals, with a week of flexibility time that we can have conversations with board members to clarify any comments you've made. And then for the renewal applications, that we then enter a 4-week period of reviews, in which we have the flexibility of 2 to 3 weeks after that to put together a packet, a funding packet, and also clarify with board members through conversations any comments and scores that you made. The one thing that requires vote here, and this is why I put this as an action item today, because previously with our notice of funding opportunity, we had intended that decisions for applications would all be made at the April board meeting. With this process, what we would recommend is that the decisions for renewal programs get made at the April board meeting, and decisions for new programs get made at the May board meeting. We do think it's important for those renewal applications to know as quickly as possible, because there's real people working in those positions whose salaries are being paid with these funds right now, and they need to know if their job's still going to be there, right? And the new programs, I think we have a little bit more flexibility. If you remember last year, we made decisions in May, so we already did that last year, and we were able to get contracts and work plans done and get people pretty quickly on board and ready to go from May last year till that June 1st start date for the programming.
Well, I make a motion that we modify the original grant process to include renewals be reviewed on a priority basis and passed on in April, and new applications be the second wave of review and accepted on our May board meeting.
Second.
Okay, Tim, we have a motion and a second. Any?
Tim is second it, Mary Ann.
Yeah, he did. I said, I probably didn't say it loud enough. Anyhow, any questions, discussion? Hearing none, I will take roll call. Dick Hunter,
Yes.
Dr. Copeland,
Yes.
Dr. Gorski,
Yes.
Dr. Giardini,
Yes.
Tim Neighbors,
Yes.
Linda Sandquist, Wendy Larson Bennett,
Yes.
Mary Ann Abadi, yes. So we've covered all of our action items, and we have one discussion item, and that is funded programs Q2 outcome report. And Jason, I'll let you elaborate.
Okay, so we have a new outcomes report for the second quarter, which means halfway through our first year of programming. You'll see with much more data, we were able to do some different types of data breakdowns. So I'll just highlight some things for you here. First of all, really impressed with where the programs are related to their custom outcomes that they're all needing to track. Some of those you'll note we talk about as special conditions. Those become part of the completion of outcomes in some cases. So from 12 completed outcomes in Q1, we're now at 37 total in aggregate. And you see way fewer delays. So from 31 delayed down to 8. 88 are in progress, up from 65, and only 19 are not yet started. So programs are really moving along towards meeting their goals that were established in their work plans. Overall, the common challenge remains the workforce shortage and hiring. Although there has been some success around that, we're now so in the first year of funding, there's about 85 positions created. If I should say the equivalent of 85 full-time positions. Some of those are part-time. So if we total all those up, it's about 85 FTE. And so 30.5 of those are filled, which is roughly about 1/3 of the positions being filled. And then if you look at actual funding spent versus what was awarded, we're about 20 to 25% there, with 1.5 million actually spent there in that first half of the year. So of course, that's not, we would expect maybe in a future year to be at 50% at the 6-month mark, but because this was the first time through, programs were not fully operational on June 1st. People are hiring, as Sue kind of talked about when she came on board. The jail talked about how their programming didn't start till January 1st with their staff. Programs across the board are still filling positions. If you look at numbers served, though, you'll see a significant increase from Q1 to Q2. So roughly 500-ish in the first quarter, and in the second quarter, over 1,800 people served in our target populations. cumulatively looking at about 2,300 served over those first 2 quarters. That's not, so there is duplication potentially between quarter 1 and quarter 2. If someone's seen in quarter 1 and then seen again in quarter 2, they could be double counted that way. So at the end of the year, we'll get a full unduplicated number for the entire program year. But each of these are unduplicated numbers for that particular quarter.
Jason, why is the service on substance abuse? It seems awfully low.
Yeah, it is low comparatively toward the compared to the serious mental illness, and that was really just the nature of the program proposals we received and funded last year. There were very much fewer on the substance use side than there were on the mental illness primary focus. Of course, most of these agencies serve dual diagnosis, so there is some overlap there as well. But in general, that is a consideration that we should probably have going into the proposals for this year.
Right.
And yeah, do we have better proposals regarding infant and early childhood? That's the other obvious. I knew we were low there to begin with, but do we have better proposals coming? Please.
I can't speak to that specifically right now in terms of, but I think that's something we need to analyze as we're doing the reviews.
Okay.
So I'll let you go over the specific program individual highlights independently. If you have any questions, you're welcome to ask, but you'll see that there's a summary of each. What we'd like to do is send these out to the programs, I think, to make sure that we've appropriately captured what they're trying to express to us and get their feedback if they feel we've mischaracterized anything, and then to publish this actually on the website as a public facing outcomes report.
And
Can we
again,
also do a little PR around this to the community?
We could, yeah. That might be a good point to do a press release and start to show people what's happening.
Or even a press conference, something to think about.
Wendy, I was thinking the same thing. This is, first of all, Jason and Chelsea and all the folks at R1, the staff working on this. This is such incredibly important work, to affirm objectively the impact of the work being done. That I agree with Wendy. There's, the website, yes, but what other means and mechanisms? I mean, the community deserves to know the magnitude of impact, and at whatever time it deserves to know where we're not meeting the mark either. It's both, in my opinion. That but this, at this point in the program's life cycle, I think this is great work, great results, and it's worth the public hearing about it.
And apparently there was an article, I didn't see it, but apparently the Register Star had some piece from the sheriff about the crisis response team and how great it is.
Yeah.
And we need to, let the community know clearly that it's from their decision to fund this through the sales tax that's directly impacting how, the jail, the law enforcement, the mental health community is trying to expand and do a better job for all of us.
5 more years of campaign work.
Well, I think it's forever. I think forever we have an obligation.
Well, it's forever, but if we're not giving them something that they could vote on again when this tax cycle is up, they're gonna vote no.
Yeah. Well, so I think
you gotta keep that in mind. It's still campaign. You want to say forever, but you still campaigning to try to keep this money, going to mental health in the community.
Exactly.
So I have a question.
You really packaged this well, Jason and Chelsea. And so, my suggestion would be to do what you did when we first started this whole thing with the grants. And that we had the big meeting where all the media were invited along with the board, and tell them about, as Bill is saying, what's good and what we've accomplished and what we haven't accomplished. But
Well, rather than what we haven't, what we still have to accomplish.
okay,
You know,
I mean, those are
WIFR,
the messages. Those are the messages. But the main thing is, I mean, and you all know this, we really do have to get higher visibility within the community about what's happening. Otherwise, as Tim is saying, when we meet the firewall, we'll lose. So
Channel 23, I Googled this while we were talking, has a story up today about the crisis response team, and they're quoting people from Carlene Cardozi at Rosecrans, and the sheriff and Craig Stallings, about the success of the crisis response team and the mental health board. So it's, we need to get a word in edgewise too.
Dr. Copeland has something to say.
I have a
Well,
question.
I want to hear it.
Well,
Question right quick. So I know that the coordination council, or the organizations coordinate with one another, but at that,
Right.
since finding qualified candidates or enough applicants to run these programs seems to be a common issue, is there, within that coordinating effort or that meeting, is there any talk about how there can be some, for lack of a better word, joint efforts to get in more qualified candidates? Everybody's having the same problem, it seems, in terms of getting their programs up and finding people.
yeah.
I'm just asking, is there any concerted effort among the organizations, or is there anything we could do to get the word out in some other arenas as it relates to these job openings?
Yes, and it's top of mind. Jason, do you want to speak to this because behind the scenes, there's a lot of trying to be coordination with the agencies. And Jason?
Yes, so yes, the conversation is happening with each agency individually for the most part, and also within these network meetings. We actually had the workforce connection come and present at the last network meeting, and they offered their business services to each of the agencies without needing additional funding. It's part of their programming. In addition to that, they presented the idea of doing a sector-based strategy where all of the organizations together would address some of the sector issues. Let's just say career pathways, for example, high school academies, higher education. So it was my intent. One of the things we put in our budget this year and in our work plan was systems coordination dollars. And we started working on a systems coordination plan to address some of those structural issues and also issues that are external to the system of care, but affect the system of care. And what does it mean to address those? So I think when we come out of our grant reviews, what I would like to do is to have a systems coordination focus and plan presented to the board with some strategies, and to potentially identify some action items for those things. In some cases, that might mean an RFP that is directed towards a specific focus to see what solutions exist for those types of things that organizations might propose to us. And that would be one of them. And I think communications coordination to a certain degree, while we're trying to do that with the individual agencies, if that's not enough, then we'll have to look at some system-wide solution for that as well.
So yeah, it's happening. One other thing I just want to mention, everybody has spoken about high concerns regarding getting the word out to the public, but the important thing you have to know is that, like today, there's going to be a press release after our board meeting about how many applications and about the collaboration. And
Yeah.
that's all going to hit the press as soon as we're done with this meeting. So I know that in our weekly meetings, Dick and I meet with Jason. That is top of mind all the time. We talk about getting the word out there. Maybe this is only my narrow opinion on the matter, but not that many people rely on the newspaper for their information.
That's true.
I mean, the majority of the population really does use social media, and we're all over social media. So even though my age group may not be doing as much of that, that is where they consume their news. So I think we have to strike a balance. And I know Jason has been working also or talking with people at Northwest what is that magazine? Northwest Quarterly.
Northwest Quarterly, yeah.
Right. And that is something Jason has a lot of experience with through Transform Rockford. They wrote articles for them. And then Jason was able to check out that this is what we want in print. And we're moving a little bit in that direction, possibly, Jason, is that?
I think, yeah, there's been a conversation started there. There's been conversations in other places with, agencies. Rosecrans was one of them. We talked to their marketing team. So, again, I mean, when articles like these come out, the goal is that we would be able to be notified of that we're talking about the 50-cent sales tax. These funded programs are making sure everyone knows the program was funded with the 50-cent sales tax. We've done a number of presentations to different networks in the community, looking at sectors. So we've done the faith sector with both the mayor's faith group. We're talking to Rockford Urban Ministries right now about joining their, doing a presentation for their Lenten series, and Reverend Copeland has offered to participate in that, as well as Dick Cooner. We've done West Gateway Coalition. We've presented to Alignment Rockford's operating board to hit the education and somewhat to that degree workforce sector. We have a presentation scheduled to go before the Chamber of Commerce Government Affairs Committee. And so that's a handful, and there's probably about double the number of those. So, yes, print media is good, news is good, social media is good. I also think getting in front of people is the best. And so that's really where I would want to focus most of my efforts. So I really would encourage board members to utilize your networks to get us in front of networks, right? So like we have a presentation and we keep updating the presentation. So every time now we'll update the presentation to include these infographics for the outcomes, and we'll talk about what it looks like halfway through the first year of funding. I want to get out and tell people that story. So as many of those meetings as we can schedule, I think that's going to give people a chance to answer questions. It's great to read the snippet that you get from one of these articles, but you don't get to ask questions, right? You don't get to do that follow-up. You don't get to have the conversation. So please think about who are the organizations or community groups that you think we should be in front of, and just let us know. I don't care if it's 7 o'clock at night on Wednesday, we'll get out in front of them.
Sounds good.
Well, you just gave me an idea, Jason. I'm going to recruit you to do some training at the state's attorney's office.
That'd be good. Okay. And moving, do we have any more comments on this? Because I'll move on to the other matters of which I have nothing to report today. And then the final is the motion for adjournment.
I so moved.
Okay, I need a second.
Second.
Okay, and roll call again.
Aye.
Finally, Dick Cooner.
Aye.
Oh, he already said aye. Dr. Copeland,
Aye.
Dr. Gorski,
Aye.
Dr. Giardini,
Aye.
Tim Neighbors,
Aye.
Linda Sanquist, Wendy Bennett Larson.
Larson Bennett, but yes.
Oh, sorry about that. I read it
That's
wrong.
okay.
And then also Mariana Body, aye. And Jeanette, and I did not include them in the roll call. And I did not include Jay Ware also. I realized that I missed greeting them. So I don't think Jay joined us today, however. All right, that's for the record. So thank you so much, everybody, and good reading.
Well, stay well,
Okay.
everybody.
Well, you
Ed,
stay well.
Ed, you got me thinking now, you know, your farm team, pitchers and catchers report next week.
Oh, my
Not around this part, Terry.
Well,
Not here they do.
Going south.
They'll be throwing snowballs here.
I
And
don't
Wendy,
know
last
about
time
that.
I wore a sweatshirt for Tim. Wendy, this one's for you today.
Where's your mental health one?
Hey, see where Chelsea is sitting with that behind her? Hang on, people. Hang on.
I want one too.
Hey,
Ball
wait till
cap.
you see it first. You're gonna look at it and go, wait.
Keep us in the
you,
loop.
Giardini? No way.
That's hilarious. All
You
right.
can send
Bye.
this out.
Hi, guys.
Good day.
Oh,
Hey,
yeah,
have a good one.
that's great. Okay, thank you, Chelsea.
Thanks,
as well.
everybody. Thanks, Chelsea and
Thanks.
Jason.